We're rolling.
Hey, Dr. Rice here.
Dr. Hogan. We're going to talk about how we see a lot of babies and infants in the clinic today and what things we work on with them.
Yeah, so being known for pediatric and prenatal chiropractic care, we end up seeing a lot of infants and pregnant women that come in, and a lot of them come in just to make sure that things are going good right from the jump. As the twig is bent, so shall the tree grow. So if we can keep things going good from the beginning, it's a lot less likely to have issues later on in life. But one of the big ones that we do end up seeing is something called Torticollis, and that can manifest a number of different ways. But usually, it's the infant, not wanting to turn its head a particular direction, and affects the nursing and the ability to nurse on one side versus the other. And what that leads to is what's known as this thing called Plagiocephaly. So you've probably seen infants with helmets on to kind of correct for like a flattening that has developed. And what's actually going on there is there's usually a misalignment subluxation in the upper cervical spine that's affecting the internal pull of what's known as the dural meningeal system. So it's a connective tissue that covers your brain and spinal cord and connects to the sutures in the skull, and that pulls internally and creates an asymmetrical or a non-symmetrical bone growth in the cranium when that baby is developing. A lot of people think it's because they're laying on that side and it creates flattening there, but most of it's actually from that internal pull that's happening that's creating that abnormal bone growth of the cranium and the skull there. So, we've helped a lot of infants and parents through this. And even if the helmet is on, we can significantly decrease the time that helmet is needed for. Just recently, I've been working with this infant for about a month here, and had a helmet on, and just after 2 weeks of wearing that helmet, the change in the millimeter difference went from 8 millimeters to 4 millimeters in just 2 weeks time. So usually they wear those helmets for 3 to 6 months for 23 hours a day, which is kind of crazy. And it doesn't actually even address the underlying issue that's really going on and causing that. It's just the external piece of it. So there's a whole host of reasons why it's important to actually get to the root cause of what's causing that issue. But anyway, that's just one instance, but there's countless times where we've helped with that scenario and kind of work that through. So anyway, check us out. We know how to take care of a lot of that stuff, and it's a pretty easy fix, and there's some good exercises we can give the parents to do to help with that. Take care.
See ya.